Hello, my name is Laura Everson, student number 8138266. This is my presentation for SNUG 202, Evidence-Based Practice Assessment 3. My statement choice is childhood trauma increases individual risk of developing a mental health disorder. Let's get into it. I first accessed the UOW Library A to Z database and used the EBSCO host. I changed my preferences to Medline with full text, academic search complete, and ticked for peer-reviewed English and narrowed my search down to the last 5 years. I then used the PICO format to help me identify keywords of my statement to help better my search. For population, I used adult. Intervention, I used childhood trauma. Comparison, non-childhood trauma. And outcome, mental health disorder. When searching, I got 391 results. The title that I looked for was something that relates or is very similar to my statement. The one I chose was childhood trauma is prevalent and associated with co-occurring depression, anxiety, mania, psychosis in young people attending Australian Youth Mental Health Services. This is written by the Royal Australian and New Zealand College of Psychiatry. Abstract. This article talks about how they will use evidence to explain whether or not childhood trauma is associated with mental health disorder. They use data from the transition study to help with assessment by using the childhood trauma questionnaire, and this study does incorporate the use of Australian mental health services and what they found when delivering their services to people. The study demonstrates the pervasiveness of childhood trauma in young people attending and accessing those mental health services. Introduction. This article writes a clear and concise introduction into what and how the study was done. It first shows that childhood trauma is common and associated with mental ill health, and then goes on to talk about the clear objective of why the study was conducted. This article's data shows the different demographics and characteristics of a population, and that is affected by childhood trauma. This can bring a comprehensive view of a population. It helps improve data interpretation by identifying patterns and trends, and helps strengthen validity and reliability of the study. Why did I choose this article? I chose this article because I found that it had relevance to my topic and that it provided strong evidence that helps with my assessment. The article published is from a reputable journal. The journal is the Royal Australian and New Zealand College of Psychiatry. This journal publishes high-quality, peer-reviewed, original research articles, reviews, perspectives, and correspondence in the field of psychiatry. When reading the article, I found that it had a wide range of different types of measuring scales to help improve their study. A few that were used were the Quick Inventory of Depressive Symptomatology, Young Mania Rating Scale, Comprehensive Assessment of the At-Risk Mental State, Generalized Anxiety Disorder Scale 7-item version, and the Childhood Trauma Questionnaire. I believe these helped collect data on a more specific scale and helped improve the conclusion of the study. Evidence of my article. The study was approved by the Human Research Ethics Committee at the University of Melbourne and the University of Sydney. They have participants aged 15 years and over provide written informed consent, and those 12 to 14 years had written informed consent by a parent or guardian. They conducted a structured interview using the clinical measures described before. The assessment took 1.5 to 2 hours to complete. Recent evidence shows that individuals experience the multiple disorder types and that mental health trajectories are better accounted for by age and illness onset, symptom duration, and number of disorder comorbidities than any single diagnosis. Furthermore, child malnutrition and interpersonal trauma appears to be important transdiagnosis predictors of involving a different type connectivity, accounting for approximately 50% of the risk for transition between mental disorders in a representative US sample. Approximately 645 out of 775 female participants reported exposure to some form of childhood trauma, either low, moderate, or severe. Approximately 84% of participants reported exposure to at least one form of abuse or neglect during childhood or adolescence. Over 67.1% reported experiencing multiple trauma types, and 39% reported trauma in the severe or extreme range. These figures are consistent with trauma reports in a group with early diagnosis using similar trauma measures and a matched control group. In the study, 89% of young people with early psychosis reported at least one traumatic experience, compared to the 37% in a controlled group, and 52% reported at least three traumatic experiences, compared with only 7% in the controlled group. The graph shown is a childhood trauma prevalence and severe by trauma type, showing the severe, moderate, and low, and the different types of abuse during childhood. Table 1 is the participant demographic and characteristics, and Table 2 is the cumulative trauma exposure and the number of types of trauma, which is 0 to 5. Compare the evidence. Finally, the strength of associations between trauma and increasing comorbidity in the current study were small, as those were found in the non-clinical groups assessed by a study by Van Neerop in 2015. These associations were stronger in adult groups with threshold disorders in the study by Van Neerop and colleagues, which may suggest that childhood trauma associated symptom admixture becomes more severe over the life course. Summarize my findings. The study shows that the high prevalence of trauma exposure in young people in the current study shows that trauma is not only common in groups with early psychosis or acute clinical setting, but extends across help-seeking youth and of varied levels of illness, severity, and mental health concerns. The gender, age, and proportion of Australian-born participants in the study were consistent with that observed across Headspace services nationally, suggesting that the data from the current study can be generalized across to Headspace services. In conclusion, trauma reports particular to severe trauma in the current study would greatly exceed those in the general population. This is supported by evidence that trauma increases the risk of mental disorder in both prospective and meta-analysis studies. The present study demonstrates the pervasiveness of childhood trauma and its association with co-occurring depression, anxiety, mania, and psychosis symptoms among help-seeking young people. Trauma exposed appears to be risk factor of the heterogeneous mental health presentations and that cut across current diagnosis silos. Mental health practitioners and health services must be constant of high prevalence of trauma and its effect in help-seeking youth and offer appropriate intervention. Reflective model using Gibbs reflective cycle. Description. The search process was methodologically and began with keyword selection made from the PICO structure and database searching, followed by full text articles. Feelings. Initially, the volume of literature was overwhelming, but refining my search terms and using filters helped narrow down my search and to look for an article more specific to my statement. Evaluation. The process was effective in retrieving high-quality evidence. However, the challenges include assessing full text and figure out figuring out the different levels of evidence. Using analysis. Using a structured search strategy helped the search to be less time consuming and understand different evidence levels. Conclusion. The experience reinforcing the importance of systematic researching and critical reading in evidence-based practice. An action plan. Future searches will have additional studies and advanced search techniques to improve the assessment. My bibliography. Thank you. Have a wonderful day.